from California, Ms. Chu is recognized.
Secretary Becerra, I want to thank you so much for your visit to my district in Monterey Park, California last month. The visit meant so much to the people of Monterey Park who are still reeling from the mass shooting that took 11 lives in January. The shooter was a person who was deteriorating mentally, who shouldn't have had a gun but did, and did terrible harm. The wide availability of guns in the wrong hands has fueled a drastic increase in gun violence deaths, as AAPI youth, in fact, have the fastest growing firearm suicide rate of any racial or ethnic group, with a 71% increase in the last decade. Because of this, I'll soon be releasing legislation to ensure that all communities, including limited English proficient and immigrant communities, have access to gun safety and prevention strategies, such as safe gun storage recommendations and mental health services for suicide prevention that are recommended by CDC. One part of the president's budget that is so important is an increase of $50 million for the suicide prevention program to expand CDC's work to reduce suicide. How will you ensure that this important research and safety guidance will be accessible to these LEP and immigrant communities?
Congresswoman, first, that was a special visit. As you know, I used to live in Monterey Park. I still have a home there. And you could see it in so many of the people's expressions, how not just painful, but how appreciative they were when anyone would give them a chance to just speak their mind. And speak their mind is important for your point, because oftentimes they're not able to communicate with authorities because they don't converse easily in English. We're doing everything we can to make sure that we provide culturally and linguistically appropriate services. The materials, we try to translate them into appropriate languages. The people we hire, we want them to not only know different languages, but also have lived experiences that relate to the people that we're trying to help. And in so many ways, we will try to support the work that you're doing to make sure that we are approaching people with services that can accommodate their needs.
Thank you so much. I'd like to have your comments on Title X and Medicaid. You know, Title X family planning has been flatlined for the last 10 years, and yet the need is greater than ever now. So I commend you and the Biden administration for proposing $512 million for the Title X family planning program, the first increase since 2014. And then there's the Medicaid unwinding. The continuous coverage requirement, you know, started during COVID, but unwinding this Friday, and millions can lose coverage. So can you speak to the importance of Title X, and also how does the department plan to protect those most vulnerable to losing coverage once Medicaid unwinding begins?
Congresswoman, we've been in conversations with governors throughout the country to make sure that they're aware of what's coming once the public health emergency comes down. We want to make sure that no American loses health coverage because the public health emergency has ceased. And we continue to work with states. Some are better positioned than others. Some are doing more than others. But every state is aware that there are a number of individuals, that could be close to 14, 15, up to 16 million Americans who could lose their coverage, even though they qualify for other coverage, whether it's through the Affordable Care Act or whether it's through existing Medicaid programs where if they reapply, they will still qualify. And we want to make sure everyone is aware of what is available to them, including employer insurance, which maybe they didn't have when COVID hit and they got onto Medicaid, but now they're employed and they have access to coverage. They need to know those things so we don't lose coverage for those Americans.
Thank you. I yield back.
Ms. Van Dyne from Texas is recognized.